81 samples from suspected cases of the disease have been analyzed in our various laboratories. Out of the 81 samples, we have received confirmation of 7 people who have tested positive for the coronavirus disease. They include 4 Kenyans, 2 Congolese nationals, and 1 Chinese national. 3 are female and 4 males. This now brings to 38 the number of those who have tested positive for the virus in Kenya. Out of the 7, 4 had a history of travel from countries with active transmission. 1 had traveled to Mombasa, or 2 did not actually have a travel history but come from contacts. On a more positive note, I'm pleased to note that our first patient, together with the 3rd patient, have tested negative in their first retesting. A repeat test is scheduled in the next 48 hours. We remain hopeful that the repeat test will be negative, confirming full recovery to allow for their discharge from our treatment center. The 2nd patient turned negative, as we already announced to you, and was discharged from our hospital. All the 7 confirmed cases are from Nairobi County. This now puts Nairobi County as leading with 28 cases of those who have so far turned positive. Kilifi with 6, Mombasa with 2, while Kajiado and Kwale have 1 each. Out of the 38 cases, 21 are male, while 16 are female. Tracing of contacts for the 38 confirmed cases is ongoing. The total number of close contacts that we have so far been monitoring stands at 1,141. Out of this number, 163 have been discharged after completing the mandatory 14-day follow-up period. Currently, our teams are monitoring 978 close contacts. We have 3 individuals who have been admitted at Bagathi Hospital awaiting test results. To date, we have now tested 833 persons for the disease. As we informed you, from tomorrow, we shall embark on a mass testing for those persons who arrived in the country last week and are currently under mandatory quarantine. This will be done in line with the World Health Organization guidelines on testing for the virus. Due to the seriousness of the coronavirus disease and its potential strain on our healthcare resources, it has been deemed necessary for the government to institute mandatory quarantine for all those who have tested positive and their contacts. Once you have been identified as a contact to a patient who has tested positive, the Ministry of Health shall send its officials to your house to escort you to a quarantine facility. The purpose of this exercise is to have close monitoring of your well-being so as to safeguard your health and particularly safeguard that of your family and your friends at large. At this juncture, I'm appealing to our people to make it very unnecessary for them to engage with the police by staying at home and observing the directives given. I'm also urging our police that people should be treated humanely. However, let me state that we are not going to pull back on the enforcement measures we have so far instituted, and this will only make things worse if we do so in the fight against the disease. I know that there are issues being raised about the curfew which started last night. However, I will not deal with matters of operations, curfew operations here, because the concerned agencies will be addressing you regarding that matter. On the part of the Health Ministry, I am asking the police to offer assistance wherever it is needed by our people, especially with nurses, with doctors, public health workers, wherever they are. I'm referring to the medical personnel, who include all those people, but also other essential services. And I'm asking for the police to assist them in carrying out their work, even if it means using their vehicles to do so. For me, these are the people I rely on as a cabinet secretary for health to assist me in this enormous task. Let us respect and support them. Once again, I appeal to Kenyans to make it difficult, if not impossible, for the police to come in contact with them by just doing the right thing, staying disciplined and staying at home at the hours given. And today, I saw somebody send me a number. I would like to share this number with you and make it our clarion call. The number 65959 is our curfew number, should be a rallying call for all of us at this time. 65959. And the time, it is actually the time. It is 6 o'clock, 59 minutes and 59 seconds. At that time, call your friend, call your family, call your colleagues, find out whether they are at home. And that is the best way of diminishing the issues that are arising and the issues that are being raised by wananchi. It was inevitable that on a first day, there were going to be issues and there were going to be mishaps. But my hope and prayer is that going forward, particularly effective a day like today, when there is no work, then we hope that these will be matters of the past. At the same time, I want to make a special appeal to all employers, all those with members of staff, ministries, government officials, that we must give people time to leave work early enough so that they can be in their homes before the curfew time. And as I said before, at this time, we are all called to sacrifice. There is no choice. And therefore, I am appealing to employers to please allow people to leave on time so that they can be in their homes by 7 p.m. The trend that we have seen here in terms of increasing numbers is not a healthy one. And I want to warn Kenyans that this is where our focus should be. It is important to remember that all the 38 Kenyans we are talking about come from one village, they come from one family, they come from one estate or somewhere within Kenya. And it is important to appreciate that the over 1,000 contacts we are talking about are also going to be with another 1,000 contacts somewhere along the line. This is how this disease spreads. This is how people in Italy and elsewhere are dying in the thousands per day. Per day. And if we want to save Kenyans, if we want to avoid the experiences that other countries are experiencing, we must do what those who have succeeded in addressing the disease have done. And what they have done is social distancing, is disciplining themselves, is staying at home when they are told to stay at home, and doing all the other hygiene measures, taking all the other hygiene measures that we have taken. It is important, fellow Kenyans, that we follow these rules. Otherwise, ahead will be extremely stark times. Let us cooperate. Let us work together towards avoiding a total and complete breakout of this disease. I thank you, ladies and gentlemen.
From Citizen, with Nairobi now appearing to be having an increased number of positive cases, is the government considering having special arrangements for the city to ensure that it doesn't spread to other counties? Talk of, is there plans to have Nairobi City County under lockdown to save other counties from having a chain of spread?
Is infected, they need to keep as much distance as possible. And you've talked of Nairobi having 28 confirmed cases. Are you able to give us the exact estate so that Kenya can be on the lookout?
Good afternoon. My name is Leila Mohammed from NTV. My question is about the quarantine centers which the 2,000 individuals that have landed in the country are being set up in. How many do we have at the moment? There are some concerns that there is a fear of them being forcibly taken to these places, and the fact that some of them are quite expensive for them.
Thank you very much. Let me start with the first one. On the issue of Steve asking about the issue of a lockdown. You know, it's very interesting that people are asking for a lockdown and they are unable to follow a curfew. I think it is very important for us to understand what is the meaning of a lockdown. What would a lockdown look like? Because if we don't address this issue of a lockdown and what it looks like, it's very easy to throw it around and say, why is in Kenya locking down the way that we hear other countries are locking down? In a manner of speaking, a lockdown is not a name, is not a word that necessarily contemplates a situation where people are now safe. What contemplates a situation that is safe is doing what the government is doing, what the government is saying. Because you can say that people go to their homes by 7 o'clock in a curfew, and they are supposed to go there by 7 o'clock. A lockdown is worse than that. A lockdown means that you don't leave your house, period. So, and the measures that we are taking are measures that are supposed to try so hard to ensure that we don't get to a lockdown. Because if we have got people doing what we are saying and keeping the social distances, it therefore means that the contacting, if the contacting is eliminated and the contacting is reduced, it means that it is not necessary because people are not passing it to each other. And this is what we need to understand, that if you look at countries with similar numbers and which countries are disciplined countries, they are not under lockdown. So let's not just talk about a lockdown. It is so important for us to understand, what does this mean? What does it mean to a person who is going to work in the morning and buy sukuma wiki as he goes along and goes home? What does it mean? So even as we talk about lockdowns, the government is working very hard to look at all structures. The president has directed that we look at all scenarios and address all scenarios, and we are doing that. But I think the scenario, the one key success factor in this whole thing, whether you talk about lockdown, whether you talk about curfew, is changed behavior. It's changed behavior. That is the key. The word that makes sense is change behavior, keep your distance, obey the law, obey the directives. That is what is going to work. Lockdown as a word can be pretty meaningless. On the issue of Nancy, you asked about the exact estates of these individuals. Yesterday I gave an example of Embakasi. There is not a single estate now in Nairobi that has not been touched with the 28 people that I'm talking about. Your neighbor could very, very easily be positive. And you know, as we start on the mass tests, we are going to get more and more and more. That is why your best defense, your best savior, is to stay away or keep your distance from the next person. The person you are standing next to right now. Look at the person you are standing next to. The person you are standing next to right now throughout Kenya. Look at that person. That person may be positive. If you know that, you will keep your distance. As for quarantining, mandatory quarantine is not forced quarantine, it's mandatory quarantine. However, what we expect when you are in mandatory quarantine is cooperation with the medical staff, is cooperation with the security staff, because understand, you are not quarantined because you have committed an offense. And I can tell you at a personal level, I have a son who we have quarantined. I have a niece who is in quarantine. And the way we are looking at it is that if a person is in quarantine, they are protecting themselves and they are protecting you. You should be very happy to be in quarantine. Because when you are there in quarantine, it means you cannot pass on the disease if you have it. And I would like to believe, as opposed to rogue operators who have been moving around knowing that they are positive, or who have been moving around knowing that they have been in countries that are epicenters of this disease. If you know that, I would like to imagine that a responsible Kenyan would hate to pass this disease to his friend or her friend, to his mother or or the father, to your children. And because you don't know whether you have it or not, and because you know that you have been in contact with a person who has it, surely a responsible individual would want to protect themselves and protect their families and protect their friends. That is why you find even senior people in the world, all the way from the Prime Minister of the UK, the Chancellor of Germany, quarantining themselves because until they are tested and until they are sure. Even here in this ministry, we are testing ourselves because we are coming into contact and we are exposed, as it were. I have been personally tested, and God was kind. I was negative. But I mean, I'm trying to bring home this disease. I'm trying to put it in your sitting room so that you understand exactly what we are dealing with. Thank you very much. Thank you. Yes, one more.
Yes. I'm not looking for kids yet. My question is about data collection and planning, especially within Nairobi. Is there an intentional effort to know how many people are actively working within their legal working hours before the quarantine so that we avoid the issue of congestion amongst our bus stations?
Yes, we are collecting data on this issue. One of the things that obviously happens at a time like now, when we have given, if you look at the President's directive regarding even the civil service and who is supposed to be working and who is not supposed to be working, if you remember the other directives that we have given, that as many people as possible work from home, what you realize is that within the city now, it has, people have dispersed quite a bit, which is good for the country. But we are also asking even those who are currently in the town and seeking support from employers, if you are able to stagger the working hours, so that, for instance, people can start early at 7, some of them, and leave at midday. Others can come at 10 o'clock and leave a few hours later, and as many of them should work from home. That way, we can reduce the congestion in the city. And when you are in the city and you are queuing for public transport, keep the distance. If you are queuing for a bus or queuing for a matatu, keep your distance. And matatus and buses are to observe the rules given. If we keep that kind of distancing and limit the contact as much as possible, then even public transport will not be dangerous. If we squeeze ourselves and rush in an indisciplined manner, just know when you are squeezing in, you might be squeezing yourself to coronavirus. Thank you very much.